Well, good afternoon and welcome to Vancouver Consumer. I'm Stirling Faux playing musical studios here. Had to run down the hall and join you in our Vancouver studios. In a few moments, Dean Kotopski, founder of the Performax Health Group, returns to our show to talk about his patented force balance technique of rehabbing injuries and why organizations like the Seattle Seahawks, Cirque du Soleil, the Winnipeg Jets, Skate Canada, and others have all journeyed to his Burnaby Center to learn his method of rehabilitating injured athletes and how perhaps your pain issues could also be alleviated. And welcome back to the program. Stirling Faux with you on this Saturday afternoon. Joined in studio, it's a pleasure to welcome back Dean Kotopski, founder of the Performax Health Group in Burnaby. Hello, Dean.
Hi, Stirling. Thanks for having me.
It's good to see you again. It's been a while since we last visited. The Performax Health Group, you are the founder of this organization. Tell us a little bit about the group and how long you've been together and where you are.
Sure, yeah. We came together in 2008. I threw it all into the middle, bought a building on Kingsway, and said, to heck with it, we're putting down a flag and going to start the mothership. My sense of humor made opening day April 1st, which is April Fool's Day. Part of me wanted to not show up for any of the treatments and do a little bit anyway. But yeah, no, we've been together since 2008, Stirling, and it's been phenomenal ever since.
Interesting stuff. Now, this is all about, Performax is all about rehabbing injuries, but the whole process revolves around something, a proprietary technique called the force balance technique that you have created.
That's correct, yeah.
So tell us, what is the force balance technique?
What is it? Yeah, great question. Well, force balance technique, in its simplest explanation, the elevator speech is it's a three-phase system consisting of manual therapy and alignment of your skeleton and soft tissues. And then once that's improving, we immediately grab onto the new range and teach your nervous system how to handle the movement of that. We use something called superimposed EMS, which is stim machines placed on the muscles to retrain the new movement.
Oh, okay.
And then we bounce back and forth within those two phases every treatment, improving your range and making you gain and keep your range, which is the other important part, obviously. If for some reason within 4, 5, 6 visits I'm not happy, or our other trained force balance technicians are not happy, our answer is not 6 more of the same.
Right. Our reassessment.
That's absolutely, well, we're always reassessing, Stirling. Every treatment, we're looking at your gains. We baseline heavily. You don't know where you're going if you don't baseline. We have a lot of tools to help us with that. But more importantly, what I've found over my career is that there's some very obvious things that are happening that are the reason for a person not getting better, mechanically speaking, and how we're approaching it. And one of the things is that it is our data and our opinion clinically that instabilities and malalignments structurally, meaning within the skeleton, are going not untreated, but they're the system to help fix that, if you will, or bring about very good resolution, has not been challenged. Pieces are being done, meaning everything that everyone is trying to do. Massage therapists are trying to loosen, and physios are trying to. I don't want to generalize.
Right.
Please don't email for the generalizations, but in general, in a most general aspect of this, that's what's going on. Kinesiologists want to help strengthen, so on and so forth, and that's all great. But the malalignments and instabilities structurally within a person's joints that are not treated properly, sprains, if you will, are leading to chronic degeneration and decreased function overall. And the one thing that we're using to help that third piece is regenerative medicine. So the third phase of that force balance technique is regen med in the form of platelet-rich plasma, stem cells. Unfortunately, Health Canada has recently shut down the use of stem cells in Canada.
Oh, really? Okay.
It's been a bit of a setback, but not a huge one. We can do a massive amount with platelet-rich plasma to help stabilize the joints. But that is the missing piece. That is one of the crucial missing pieces.
my takeaway, and it's been a while, it's been several months since you were with us, but I do have a very clear recollection of your last visit with us because I have a bad back. And so I pay attention when people show up who can help me with my bad back. And your message was really simple. It's all about alignment. And you've used the word 3 or 4 times already, Dean. If you're not properly lined up, then no matter what your problem is, you're still not properly lined up. So how does one go about knowing whether the alignment, it's easy to do in the car. You can pull it into the service station. They put it up on the hoist and go, yeah, you're okay. What's the human equivalent of that? How do we find out if we're lined up properly?
Well, there's many different ways. There are many different techniques that therapists can use: grid systems, laser systems, visual systems, movement systems. We use a bunch of that.
Okay.
I'm going to just bring you back real quick here to that car analogy.
Okay.
Because I love this. I've been a car guy since I've been 8-9 years old. And truly, this is what has led to me understanding the necessity for alignment. I'm going to go one step further on that. It's not just the alignment, it's the stability of the alignment. And many things can bring about stability within a joint structure. But if those are broken, we need to make sure that that capsule and ligament can be stabilized. And this is where that regen med part comes in that we can talk about later.
Okay.
But it's not all about alignment. I'm going to just caution you on that just a little bit. Alignment is the first phase.
Exactly.
Absolutely it is. And let's bring it back to the car. I mean, we can look in the architectural world when they design a building or anything that you start with has to be built from a stable and aligned foundation.
You bet.
And we know this as therapists. The problem that I'm finding is that, for whatever reason, that isn't consistently being done. And I'm not here to hack on anyone else's treatment system. I'm not doing that. I'm just saying that in order for this is just my experience and what we do. We start with alignment phasing. So we take a look at what you're doing, at what your alignment looks like in static and movement postures. And then we start assessing where it's wrong. And for us, a huge part of this is in the pelvis.
Let me stop you just to ask you a car kind of related question. I said, you put the car up on the hoist, and the guy looks at it and goes, yeah, it's okay, and it maybe need an adjustment here or there. Do you have a similar hoist in your shop?
Yeah, they're called treatment tables.
Okay, so a person can lie down and be somehow or another technically assessed by a machine of some kind, or is it just one of your colleagues who will do that alignment assessment?
Yeah, so typically, if we're going to talk about this very specifically, we're going to do static and dynamic postural assessments. Static being you laying down. Right? Or standing, and then we will actually get you to move, do some movement phases as well. Not only that, what I make absolute sure of is that we will use something called a dynamometer, which measures force output. And just for example, I will lay you on your back, and if I want to test I know darn well that if the pelvis is off and you have lower back problems structurally, there's a muscle that attaches to the front of your spine called the psoas. It's a major hip flexor. Many people have heard of it, but I know darn well that muscle, most likely on one side or the other, is going to be weak. And I want to show you exactly how weak it is. So I bring out my dynamometer, we force test it, and I show you exactly within 1/10 of a pound what that muscle is producing, because ultimately I know that muscle force production is absolutely reliant on the alignment and stability of the joint and or joints that it crosses. End of story.
Okay. Now, is this assessment possible, Dean, on an individual who is in considerable pain?
Of course. Yes, it is. Absolutely. Now, obviously, we're skilled and trained to not be able to, we're not going to overpower you.
Right.
But that's a great question, because that is to see a patient's eyes, to see someone who's been debilitated for years lay down, and for us to look at them very intensely and do these tests, and for them to say, why has no one taken the time to do this exact thing, is extremely exciting for me, because when I can show a client what's going on. I pull out my iPad, I pull out my phone. I've got apps on there that are skeletal models 3D that I can show you exactly what is going on. And you can just see people's eyes light right up.
Right.
So
that's what's wrong.
Well,
it feels terrible, but I can't identify it any more than my whole knee is just hooped.
Yeah, listen, there are studies done, Stirling, that show consistently that people that have left your first visit without you doing a single thing except instilling some hope into them will report feeling less pain. Over 80% of those people.
The power of information, right?
The power of information and education. Yeah. Absolutely. Yes. These people need to be educated. And hey, listen, I've just developed one system. It's not the Holy Grail. It's not a miracle, Stirling. This is not a miracle. This is just a very pragmatic system that I've developed since I was a young child, wrenching on cars, that I am now applying to humans. That's all this is. I have 3 different degrees that I have. Physio, chiro, massage. All I know about that is that those are tool schools. Those are tool schools. How can we expect to actually employ or be able to give a therapist the ability to resolve something from A to Z if we send them to a school and then when we graduate, we hand them a tool? We all learn how the car works. We all learn how it breaks down. And then when chiros graduate, they get wrenches. When physiotherapists graduate, they get Allen keys and screw guns. When massage therapists graduate, they get some other kind of tool. Well, all I know is when I'm working on my 67 Chevelle and something goes wrong, if I don't have the proper tool, I'm deficient.
Sure.
What do I do? I mean, if I have a screwdriver and I need a wrench, what do I do? Right? So that's force balance technique. Not only is it inclusive of a multitude of tools being applied through each treatment and every treatment, it's based on a logical and progressive and cohesive system. There's checks and balances every step of the way, with the ultimate goal is to restore alignment and structural stability within the joint structure to allow for better force power production through that muscle. And that's as simplest as I can say it.
This is a proprietary technique. It is trademarked. It is in the process of being patented. How long has it been a thing? How long has the force balance technique been around? How long have you been using it?
Well, I've been seriously developing it within the last 5 years.
Okay.
I received my marks. They're called marks, the Canadian Trademark whatever it is,
right.
Last year. So I have my marks now for it. We're intending to take that into the States as well. But it's really been a thing since I've been in my career. I've been at this for over 30 years now. But we got real serious about it about 5 years ago and started implementing it into the various populations, athletic world and chronic pain world mostly.
You can check out the website while we take a news break if you'd like. It's performaxhealthgroup.com. The founder of the Performax Health Group is Dean Kotopski, and he's going to talk a lot more about the force balance technique when we return here on Vancouver Consumer on CKNW. Welcome back to the program. On this Saturday afternoon, I'm Stirling Faux, joined in studio by Dean Kotopski, founder of the Performax Health Group. And we recommended you check out the website during the news break, and we gave you performaxhealthgroup.com. But there's another much shorter address that'll take you to exactly the same place, Dean, and that's FBT, which of course represents Force Balance Technique, FBTnow.com. Same website.
That's the one.
And this talks all about Burnaby's #1 integrative rehabilitation clinic, the home of force balance technique, physiotherapy done differently.
Absolutely done differently.
Okay, and this, of course, is a proprietary technique that you've been working on and using for 5 years or so. Now, we know that earlier this year, long before the NFL season, which is now in preseason mode, the Seattle Seahawks training staff came up to Canada, to Burnaby, to spend some time with you and your team to learn about your technique. Their job is getting highly paid professional athletes who get banged up in football games games back out and into the game as quickly as possible. So they're looking for all sorts of techniques and methods of getting that accomplished. What did they learn from you?
Well, they didn't learn necessarily from me. They learned from my associate, who is a representative of force balance technique,
Okay.
Derek Hansen. So Derek is a nationally recognized, internationally recognized strength and conditioning coach and a sprint expert, if you will. Derek's traveling all over the United States right now, teaching people about running mechanics and better ways to move. Seattle Seahawks. This is a bit of an introverted story. It goes, so I don't want to make it a big one.
Right.
I'll just say this, that their training staff wanted the expertise.
Sure. As did the Winnipeg Jets, as did Skate Canada, as did Cirque du Soleil. You've got a pretty impressive list of clients, you know.
Yeah, it's cool and all. It is neat. That sort of stuff is neat. I've been doing that kind of thing my whole career. It's just like F1 racing, right? All the technology from F1 trickles down into the cars we drive today. Well, working with elite athletes is kind of the same, right? That's where the high-end technology and testing is going on. So it's incredible, and I'm honored to do that kind of thing. I've got to be honest. I'm equally, if not more, interested in working with those that are suffering, like the chronically disabled, man. Yeah, right. There's,
people who live with pain and who don't particularly want to get strung out on opioids, and that's a real concern. And so we're looking. I'm sure people are coming to you on a very regular basis, going, "I hurt really badly. My doctor's got me on painkillers. I'm more worried about becoming addicted to those bloody painkillers than I am dealing with my own pain." Right. So, what can you do for me?
Yeah. Yep, I don't trade a lot of sprained ankles these days.
Exactly. Yeah.
My practice is definitely morphed into the chronically injured, and
you hear that from people though about this whole opioid business. They just don't want to go there anymore. They don't want to risk it. It's
a horrendous thing. I don't want to get too deep into this. The horrendous thing right now is that the people that really need those opioids are being restricted from them.
Yeah,
that's the sad part.
Yeah.
They've kind of like swung.
The pendulum has swung too far in the other direction.
Anyway, so as a result, go ahead.
Yeah. No, I was going to ask you. You're talking about your colleague traveling all over the United States and working with runners and their techniques and so on. You just got off a plane recently from Chicago, and one of the biggest conventions of its kind in the world. And this goes back to something you talked about in our first segment: regenerative medicine.
Yes.
What is that?
Wow. Yeah, regenerative medicine is medicine in. Well, basically, the term is orthobiologics, or orthobiology. Orthobiologics are the use of cellular, the use of your own human cells in some form or way that we can isolate them and reintroduce them to the body in a more concentrated form wherever we want. So the most common, really, that we're dealing with now is PRP and stem cells. And there's many forms of stem cells and platelet-rich plasma. There are new things now that are called exomes. The field can get very confusing. I don't want to confuse our listeners at all. Let's just say it like this. The way I view it is we advance your evolution by thousands and thousands and thousands of years, if you will. If we actually are allowed to get that far in our biological evolution, I believe we will be able to, because we're getting more adept and proficient at healing ourselves as humans to a certain extent. But what this is doing is we're drawing some blood from you and we're isolating some form of that blood, some whole part of that, some form of that blood, and re-injecting it where we need it.
So it's all you.
It's all you.
Right.
It is all you. And like I said, Health Canada has stepped in now because they're concerned about manipulation of cells outside of the body. So the research now is extremely high end for platelet-rich plasma, and done well and done properly, guided with ultrasound. And we use fluoroscopic guidance under X-ray as well as ultrasound guidance by licensed health practitioners that are working closely with someone like myself.
Right.
You can have incredible effects. Now, if I can just back up one quick sec, force balance technique is exactly that process. And I'm going to give you a quick example.
Sure, please.
And this is what I talked to some of the heads of state in Chicago, which blew my mind. I'm telling you, man, I was sitting there, Stirling, with 728 attendees, physiatrists, DOs, surgeons, interventional radiologists, you name it, and little old physio me guy I've been doing orthobiologics for the last 10, 12 years, utilizing them in a system. I'm sitting there and I'm listening to these guys and their amazing research. And I'm thinking to myself, man, hang on a sec, boys, because if you're injecting that stuff into a knee to help a cartilage or a meniscus or something, say in the inside of the knee, but you haven't done anything to align that guy's structure, and you haven't done things to create, that's not going to create a lasting effect. So force balance technique is the best of both worlds.
So you get the alignment first, and then if it's necessary, after the alignment has been identified and if necessary corrected, part of the correction could be the use of this regenerative medicine.
Absolutely. And we're doing it. This is what we've been doing in my clinic and with my colleagues for the last 10 years. Once again, and I'm only here to tell you what we're doing, not what others are doing. What we're doing is we've devised a cohesive process to maximize our results, okay? It's never made any sense to me to start loading a twisted frame. Okay, here's my car. I got a 1,000 horsepower engine in my car, but I got a cracked frame. How much of that's getting to the wheels? So it doesn't make any sense to me to start injecting something without creating the most optimal biomechanical arena for that to have a long-lasting effect, because you're going to wind up right where you were. So
you're increasing the risk of success by doing the very patient and perhaps even time-consuming, but ultimately very necessary alignment.
Absolutely. And all we are concerned about, Stirling, is results. That's all I've ever been concerned with my whole life. Like I said, working with those pros is cool. Getting accolades here and there and awards, whatever, right on, great. That means nothing to me. I shouldn't say it means nothing to me. Let me backtrack. I'm very honored for that stuff. What means way more is helping that person that's been struggling for 3, 4, 5 years, man, that has been everywhere and seen everyone and done everything. And I take a look at him and go, hang on a minute. You're way unbalanced. You need to be balanced so we can start getting these muscles to function a little better. Take some pressure off the joints. Let the inflammation settle down. Get your sleep going a little better, right? And all of a sudden, that'll fire up the old diesel engine, and then we load it and test it. And if it doesn't handle the load, we back off, do more imaging, and bring in Regen Med. And Regen Med, PRP and stems can help strengthen the capsule, the white fiber, the collagen, the collagenous fibers that are responsible for the integrity of those joints. Because if you don't have, hey, listen, that conference we were talking about in Chicago,
yeah.
Okay. Dr. Brian Cole, renowned surgeon, Chicago's best doctor in Chicago, Bulls, you name it, Sox, the guys around. He's leading the charge on orthobiologic research.
Okay.
Brian walks up, first speaker of the day after Stephen Sampson, who runs Toby, he runs that conference, stood up, keynote, and then he introduced Brian. Brian's first speaker, and you know what he said? Hi, my name's Dr. Brian Cole. I'm a surgeon. And guess what? I don't operate on 80% of my patients. I do Regen Med.
Interesting.
This is a big deal, bro. This is a huge, huge deal. Now,
is it as popular or even widely practiced here in Canada as it is south of the line?
Not at all.
Okay.
Not even close.
Okay.
No. And I'm all for Health Canada's decision. I want Health Canada to regulate this stuff, because we've got people that are shooting PRP that are not licensed to even inject wet needling, if you will. So buyers, please beware out there. Please do your research. Understand who's doing your work. Are they doing it guided? Meaning, are they doing it with some sort of form of guided tool like an ultrasounder? Once again, we're using fluoroscopic guidance, the best of the best, X-ray guided technique. Okay. This is all about the best way to increase our results, so you don't have to be in my clinic. I like you. I don't want to have to keep seeing you, man.
Right.
And if like I said, 4, 5, 6 treatments, if things aren't going bang, bang, bang like this, we stop the program. The answer is not 6 more or 20 more
right.
or 30 more. of this stuff, right? It's not hard. It's not a difficult thing to resolve biomechanical issues. You might not get 100% with that client, but we can do better. The public deserves better from us, and we can do better for them.
I just looking at fbtnow.com, which is the other door to the Performax Health Group website. And on it, you say, we treat ICB and MSP claims as well as offer direct billing to all these providers. So have you, dealing with these ICB claimants, as an example, Dean, have people come to you still suffering pain from a car accident of some description, and they come to you going, well, I hope you do better than the last guy, because I've been to 3 different places and I'm still hurting as badly as I did the day after the accident. Nobody's been able to help me so far. Have you heard that routine?
I hear that all the time. And I want to mean...
And it's not knocking other techniques.
No,
it's just
man.
That individual has yet to receive relief.
Listen, I'm going to say it. I'm going to say this point, okay? And I want to remain humble and I want to remain accountable to my clients, okay? And I mean nothing as a hack to anything other than we all need to do better. We can do better for these clients. And it turns out 80% of these clients will do reasonably well in a physiotherapeutic program or a rehab or seeing their chiropractor hey man, everyone's doing the best they can out there. Everyone's doing a good job out there. It's not the practitioner's fault per se. I don't want to blame anyone.
Right.
It's just that we've limited their effectiveness to a certain degree. And we've created this fragmented system. So, but it turns out with even this system that we have, roughly 75% will do okay in that system. Mm-hmm. I'm not talking about that population. I'm talking about the 20 to 25% that are malaligned.
Never get better.
They've been sprained. Spinal sprains, bro. You have a spinal facet sprain and you're telling me that a strengthening program is going to be able to help a chronic spinal facet sprain or a degenerative disc? They're injecting discs down south now with PRP and having extremely good results with this.
Really?
Absolutely they are. 100%. Listen, this is anything I say here I can back up with research. Okay. We need to look at this. We need to incorporate this as a cohesive system. And once again, the best I've been able to do with my colleagues, like Kinetics Medicine in Vancouver, Doctors Helper and Bala, Case is there, Darren Gray. Mm-hmm. These guys are committed to excellence, right? This is where we're going to start nailing this. I want the best of the best, because all we want to do is get the best results and the most long-lasting results in people's hands. That 25%, those are the people we want to see.
Interesting stuff. Now, how would someone like me, listening to us right now, Dean, who has some chronic pain, there's something that's just been wrong for a long time and it feels like it's never going to get better. How do we go about knowing whether we're even aligned properly? How do we get to you? Do we book an appointment? Do we go to the website? Do we call how do you get through to you and your team?
Yeah, absolutely. You can call, I'm the clinical director of our crew, and I absolutely will somehow, somewhere, I'm going to come across these patients. If there's a problem in there, they all get kicked up to me. I still treat, Sterling. I'm treating every day. Okay. I will not. You know what? The nice thing is everyone's telling me to back off the tools, so to speak.
Right.
I don't want to. I like being in the trenches, man. It gives me that feeling of that one-on-oneness with the client and giving back. God willing, I'm going to do this until I'm in the ground. So yeah, man, you can get a hold of me, no problem, through my clinic, through the website. You call and you ask to speak to me. I will say one thing, as a result of our last show, we've had a few clients that heard this on the radio and have walked in, really terribly not broken, and sat and said, I need a miracle. FBT is not a miracle. Mm-hmm. This is not a miracle. This is a really solid way of giving really solid results.
Dean Kotopski and the Performax Health Group is located at 6170 Kingsway in Burnaby. You can reach them at 604-433-0100. All of that information is on the website with 2 doors, performaxhealthgroup.com or fbtnow.com. Dean.com. Dean, great to see you again. It's been a long time.
Really good to
Come
see
back
you,
and
man.
see us again. This is a wonderful story, this force balance technique stuff, and I'd like to hear a lot more.
We'll be here, I believe, on September 7th, I think.
Fantastic.
Again. Yeah.
Good stuff. Glad to hear that.
And I'm happy
we'll take
to
some
talk.
calls
And
next
absolutely.
time, okay?
You got it.
We're back after this.